Welcome, everyone. We'll just wait another minute or so while people are joining, and I'll introduce our presenter, Dr. Michelle Drapkin, in just another minute or so. We'll give people some time to come in from their break. Okay, I think we'll get started. I'll introduce our presenter. This workshop is motivational interviewing as a path to personal change. Thank you, Yolanda and Michelle. It looks like people are joining, so that's great. We have Dr. Michelle Drapkin with us today. Dr. Drapkin has been working in the area of behavior change for over 20 years. She is the owner and director of the CBT Center and previously held roles in industry such as Johnson & Johnson, academia, University of Pennsylvania and Rutgers, and federal government, the Department of Veterans Affairs. She has dedicated her professional career to using psychological research to help people. She is a board-certified clinical psychologist and sees patients in her private practice, consults with healthcare tech startups, and delivers trainings and workshops on communication, motivation, and health and well-being at work and in life. She is the sole author of the Motivational Interviewing Path to Personal Change, the essential workbook for creating the life you want from New Harbinger Publications. And just personally, if you have an opportunity to follow Michelle, Dr. Drapkin on any personal or social media, I follow Dr. Drapkin on LinkedIn, and every time she posts something, I may not always comment or react, but it's always kind of such a poignant bit of information. So I know she has that information at the end, so we will review that. And yes, please, let's hear Dr. Drapkin's discussion.
Thank you so
And
much.
I'm sorry, Dr.
Go
Drapkin,
ahead.
as in every workshop so far, please use the chat or the Q&A. We'll be looking at that throughout, so please feel free to use those resources. Thanks.
Awesome. Well, I'm really excited to be here. And yes, please connect with me in the social media realm. I spend a lot of time on LinkedIn because I consider this the beginning of our relationship together. And I'm going to do my best to make our time together, which is so short. So one of the things I'm going to do my best to find my feet, stay in the moment, and not try and like speed us through and give you too much information too quickly. But I'm grateful to hear. It sounds like there's some challenges with the sound. I just want to double check because sometimes it's an individual problem versus and so let's just stop for a second and see. Can you slap me some Y's if you can hear? But what I mean is just throw a Y in the chat if you could hear myself and Joni. You could hear us okay. Okay, so it looks like overall we're doing all right. Thank you very much. First of all, thank you for the engagement. Thank you for the validation. So if you're having any trouble, I would say reach out, back channel to our friends at BFairs. They're the host and can help you, or just check some of your tech that's going on. Thank you for. All right. I'm going to ask us to take one more minute to transition. This is a way I often start meetings and workshops to really just help us center ourselves. And so I do it this way. I ask my Apple Watch, I say, can you set a 1-minute timer? And what I want you to do in this next minute is do whatever you need to do, whether it's find your feet, so notice where they are, they've been here this whole time, or take a deep breath, or send that text message, put your phone on do not disturb, so that we all can really be here together for the next 40 45 minutes, whatever we have, that we're really present and engaged and hearing each other. And so just take this next minute, if you're just joining us rolling in, really just to make sure you're connected and present. And maybe you just breathe. And know you're breathing. Sometimes it's hard to hear on Zoom, but I have my little singing bowl, which I'm still learning how to play very well. But welcome aboard. That now we're all here together, and we're going to spend the next 40 minutes or so really working together to think about how do we leverage motivational interviewing for change, including our own personal change. And I'm going to give you some options to engage in this journey together today to really get the experience. We'll talk about some foundations, give you a little bit of a taste, some tools and tips, and then wrap up. And one of the things I'm also going to encourage you, I'm giving you lots of advice, but in the spirit of MI, you take it or leave it. You do whatever you want. But I often keep sticky notes around. And so be thinking about what's sticking with you today. And so if there's an aha moment or something you're thinking about, write it down, send yourself a text message, send yourself an email, take a shot of the screen so that you have it with you. You'll get the slides, but if it's something that's really poignant to you that you want to have with you, take it away. Because that's partially why I'm here, is to help give it away and to help. It's partially why I wrote the book, was to really just get to a place where people can have access to more materials and do more. And I'm continually thinking of ways to do that. And so thanks, Joni, for the shout out on LinkedIn. That's one space that I try and just disseminate information. Also Instagram, and we're all over the place. We try to be. Just quickly, I'm not going to review a ton of science or research. I'm also not the only expert in this room. Everyone here has expertise they're bringing to the table. And I'm going to do my best in this webinar format to make it as interactive and fun as possible. It's not always easy. Speaking of data, I wanted to, we created this little infographic to just help you know that with the foundation of motivational interviewing, everything I'm going to be talking about has a robust science behind it. There's over 2,500 published trials. In fact, Bill Miller, who's one of the founders of motivational interviewing, keeps tabs of this. We just got an update. And so there's more all the time. There's plenty of me out there in the world. I'm a member of the Motivational Interviewing Network of Trainers, and there's over 1,600 of us globally. In fact, I just told Joni I'm leaving next Wednesday to head to New Zealand for our global conference this year is in New Zealand. So as soon as I wake up from the jet lag, I get to spend time with a bunch of motivational interviewing trainers. And there's lots of different pieces. So this is really, this is the MI in numbers, right, of all of the important spaces. And MI has been, the books for motivational interviewing have been converted into 62 languages, and and counting. Okay, so here's the place where I want you to set in, and I want you to think about, this is the personal change piece. Take a second and think about all of the changes you yourself are considering making. Think about the whole spectrum of all of the stuff that you've been working on changing. And then I want you to allow your mind to kind of land in one particular thing about yourself that you feel like you want to change, you need to change, you should change it. Oh, you've really been thinking about making this change, but you just haven't changed it yet. So something that you're ambivalent or stuck on, right? And so I want you to really think about that. Take a second, allow your mind to kind of flip through all the different potential changes and allow it to land in one particular change. And now I want you to think what it might feel like if I said, hey, by the time we're done today, you're going to have to make that change. You're going to need to commit to making that change by the end of today. It is time to stop being a baby. Just buckle up, make the change. You got to do it. This is ridiculous. All of the excuses are just, you got to make this change. Now I want you to think about what that might feel like if I told you to just stop it already. And so go to the chat, and I want you to think about it for a second and then enter in some of your reaction of being told to just buckle up and make the change ready, but don't hit enter. So type it in, and it could just be a word or a feeling or some thoughts. You can put some expletives if you want in nice ways, or you could say that you're thinking expletives. But when someone tells you to just make the change ready, just like wants to shake you, what is it like? And so enter in the chat, but don't hit enter, because we're gonna enter all together so that so it flows for all of us. Some people take a little bit longer to process, some people take a little bit longer to type. So just really think about it and go ahead and type in, but don't hit the enter button if you could resist. All right, now go ahead and hit enter and let's see what comes up. We got a couple FUs, right? A couple people pushing back over like really like, ugh, like who are, and someone said, who are you? Annoyed, unkind, scary. Although I love this, Deirdre, scary yet exciting, right? Because there's something like mobilizing, like, oh, maybe I could do this. Concerned, hurtful, annoyed, resistant, rushed, right? Like rushed, like who are you? And pressured, thank you. Forced, concerned. I'm not, minus the excited, I'm not seeing a lot of like, I'm not seeing a lot of, yes, this works for me. And yet a lot of times, this is the way we talk to ourselves and people talk to us about making changes, right? There's not this compassionate approach of like, well, what gets in the way? No one really has these conversations. In fact, and so I'm gonna show you this fun video. You might have seen this before, but I really love it and always think it's worth, oh, there it is. Okay. Hopefully you can hear it.
Dr. Switzer?
Yes, come in. I'm just washing my hands.
I'm Catherine Bigman. Janet Carlisle referred me.
Oh, yes. You're being buried alive in a box.
Yes, that's me. Should I lay down?
Oh, no, we don't do that anymore. Just have a seat. And let me tell you a bit about our billing. I charge $5 for the first 5 minutes. And then absolutely nothing after that. How does that sound?
That sounds great. Too good to be true, as a matter of fact.
Well, I can almost guarantee you that our session won't last the full 5 minutes. Now, we don't do any insurance billing, so you would either have to pay in cash or by check.
Wow, okay.
And I don't make change.
All right.
And go.
Go.
Well, tell
What?
me about the problem that you wish to address.
Oh, okay. Well, I have this fear of being buried alive in a box. I start thinking about being buried alive and I begin to panic.
Has anyone ever tried to bury you alive in a box?
No, but truly thinking about it does make my life horrible. I mean, I can't go through tunnels or be in an elevator or in a house, anything boxy.
So what you're saying is you're claustrophobic.
Yes, that's it.
All right, well, let's go, Catherine. I'm going to say 2 words to you right now. I want you to listen to them very, very carefully. Then I want you to take them out of the office with you and incorporate them into your life.
Well, shall I write them down?
Well, if it makes you comfortable, it's just 2 words. We find most people can remember them.
Okay.
You ready?
Yes.
Okay, here they are.
Stop it!
I'm sorry?
Stop it!
Stop it?
Yes, S-T-O-P, new word, I-T.
So, what are you saying?
You know, it's funny. I say 2 simple words, and I cannot tell you the amount of people who say exactly the same thing you're saying. I mean, this is not Yiddish, Catherine. This is English.
Stop it.
So, I should just stop it.
There you go. I mean, you don't want to go through life being scared of being buried alive in a box, do you? I mean, that sounds frightening.
It is.
Then stop it.
I can't. I mean, it's been with me
No,
since
no,
childhood.
no, no. No, we don't go there. Just stop.
So I should just stop being afraid of being buried alive in a box.
You got it. Good girl. Well, it's only been 3 minutes, so that will be $3.
Actually, I only have a 5, so
Well, I don't make change.
then I guess I'll take the full 5 minutes.
Fine. All right. Well, what other problems would you like to address?
I'm bulimic. I stick my fingers down my throat.
Stop it! What are you, nut of some kind? Don't do that.
But I'm compelled to. My mom used to call me fatty.
No, we don't go there.
But I've been having this dream.
No, we don't go there either.
But my horoscope did say.
We definitely don't go there. Just stop it. What else?
Well, I have self-destructive relationships with men.
Stop it!
You want to be with a man, don't you?
Yes.
Well, then stop it. Don't be such a big baby.
I wash my hands a lot.
That's all right.
It is?
I wash my hands all the time. There's a lot of germs out there. Yeah, don't worry about that one.
I'm afraid to drive.
Well, stop it!
How are you going to get around? Get in the car and drive, you kook.
Stop it!
You stop it! You stop it!
What's the problem, Kathy?
I don't like this. I don't like this therapy at all. You're just telling me to stop it.
And you don't like that.
No, I don't.
So you think we're moving too fast? Is that it?
Yes. Yes, I do.
All right, then let me give you 10 words that I think will clear everything up for you. You want to get a pad and a pencil for this one?
All right.
Are you ready? Mm-hmm. All right, here are the 10 words.
Stop it or I'll bury you alive in a box!
All right. Let me get back to you. So this is not MI. If you drop off at any moment here, know that what I just showed you is anti-MI, right? It's a little bit of what we call the fixing reflex. And this is some of what we heard in the chat, right? The pushback that she gives and that you all gave to me, if we just say this is so easy, people just, they don't feel great about us. And they're not going to want to be in a relationship with us where we're trying to help them change themselves. And I want you to continue to be thinking about how people talk to themselves as well, because this is a piece of a personal change. And a lot of people have this inner critic who is talking to them, a little bit of like the Bob Newhart character, right? Who's just telling them to just do it, just stop it. And so really raising awareness to this and what's happening for someone is a big piece of what we do. And this is some of the fixing reflex where someone just, talking to them as if they need to change, they have to do it. Now's the time to do it. A tough approach is always the best. They need to follow my advice. I certainly, in fact, at 2:30 today, I have an appointment with one of my physicians who I gave my book to. I brought her in my book, signed copy, and still the next time I saw her, she was all over about the fixing reflex and telling me all the stuff I need to do. In fact, I need to bring to my workshops the sticky note that she wrote for me about all of the stuff I had to do, including a little bit of fat shaming me in front of my husband. And that was, it doesn't make me want to talk to her. So the fact that I'm there, have to be there at 2:30, I'm really just seeing this through. And I think she means well, but she doesn't know how to do it. And so I really spent a lot of my career teaching folks, a lot of healthcare providers. I'm on a mission to help empower people to use the good skills that I think they all have on board and the passion and motivation they have to help people to do it in a way that's more effective. And motivational interviewing is one path or tool to doing that. And it's as simple as it's just a way of talking to people about change. And this is actually new to this edition of Motivational Interviewing, change and growth, to strengthen their own motivation and commitment. And it's just really about the how. And at the end of the day, this is like the 2-word definition that one of my colleagues, and this, it's just about drawing out from people why they want to change or how they want to change, as opposed to telling them just to do it or to just stop it. It's not as easy, right? It's not Nike. It's not as simple as just do it. Motivational interviewing has been around for a long time, so I'm not telling you anything new. In fact, these are not even a comprehensive list of the books. There's been more coming out in different areas, specialty practices, MI and CBT, nutrition, anxiety, addiction is where it started 40 years ago. And then this is kind of the newer space of really applying MI in a self-help way. So really, how do we help people help themselves? Which is kind of funny because as a psychologist, I think about really that's, I'm helping people help themselves. I'm just really a witness, a coach, a supporter without being a cheerleader, right? Because that's not MI either. And so it's really thinking about these different pieces. So the pivot to self-help has been an interesting one. In fact, when New Harbinger asked me to write the book, I was like, ooh, I'm not really sure I could do this, because MI is a way of having a conversation about change. How do we help people do that with themselves? And it's really just about this place of, if you think about it, we talk to ourselves all day long, right? In fact, Joni and I were talking, congratulations to Joni, who now has her doctorate. And I noticed that she had a doctorate after her name. And I was like, I've known Joni for years. I don't remember the doctorate, but my talking to myself was thinking, my inner critic was like, well, maybe you just didn't pay attention, Dratkin. And you probably shouldn't say anything because that's going to make you look bad. Right. Whereas I was remembering accurately last time Joni and I talked, like she's defended her dissertation and graduated since then. Bravo. It would have been so much better if I would have just allowed myself to say, congratulations. It looks like you finally got through graduate school, which is a huge accomplishment for all of us. And so it's really thinking about this inner critic or this conversation, which sometimes it's not always an inner critic. There's a lot of different voices or forces on our bus. The passengers on our bus are all really complicated. But we can do some of this for ourselves by drawing it out, listening to ourselves, empowering ourselves in ways that help us move forward, and being kind to ourselves. And so one of the things I love us to do, if you're willing to join me on this journey, is just take a 5-minute self-compassion break. And this is from my book, but you can Google self-compassion break and find Krista Neff, who's one of the founders, one of the leaders in the self-compassion movement. You can play a self-compassion break from her website, which is awesome. So just know this is here. But I want you to bring up that change that you were thinking about, right? Bring it back up, the one that I told you to just stop it earlier. But now I want you to bring it up and just really think about it. And now with that source of struggle in your mind, I want you to take a second. We're going to try and turn our kindness to ourselves. We can be so skilled at being nice and gentle and patient with others, and yet we tend to be so hard on ourselves. So we're going to take those skills and turn them onto ourselves by saying to ourselves something like, ooh, this is tough, right? Like this thing I've been working on for a while. Ooh, yeah, this is stressful. It's frustrating that I can't make this happen. Or scary, whatever works for you, whatever language. But this is awareness, because when you bring that struggle up, the change that you've been thinking about making but haven't been able to make, you might start feeling bad and start judging yourself. And so you're being aware of what it feels like, acknowledging how hard it is. And next you want to say something like, well, struggling is a part of life, right? Other people struggle with change. I'm not alone. Change really is hard for other people, for everyone. And that's what we refer to as common humanity, where struggling is a part of life for all of us, and you're not alone. It feels that way sometimes, that we're alone. And part of this journey is really realizing that struggling is part of life. Stress is part of life, right? We're all in this together. And that's a little bit of empathy for yourself And that piece of just really realizing this is part of the common human experience. Now, the next part is something called the soothing touch. And you'll see I already have my hand on my heart because this is my soothing touch. It could be your hand on your heart. It could be both hands on your heart. It could be a fist if you want to be kind of, a sign of strength. And it may feel silly to you, but it's this kind of like being kind to yourself. And then whatever you need to say to yourself, may I be gentle with myself, may I be kind, thinking about what you really need to hear to help you really stay engaged in the moment. May I be patient with myself, may I forgive myself, may I be gentle, and may I show myself the same compassion that I often show others. And I know we have a ton of helping professionals in this room, and we're so gentle and kind and compassionate with others. We do it with our dogs, our animals that we love. We do it with our tiny humans. And sometimes we're so mean to ourselves. So think about that and really try to be compassionate. So I want to go back to chat waterfall and just quickly think about what you can put in the chat, what this was like for you. How might you show compassion for yourself or kindness? And then just write in a couple words and hold off on hitting enter so everyone has a second to do it. Because again, some people are, thinking through. All right, go ahead and hit enter. And we'll take a look at all this kindness. Oh, treating myself like I treat my clients. Taking a break. Oh, putting on hand lotion. Thank you, Lori. I have hand lotion all over the place. Skincare every Friday. I love that. Reading and spending time with your grandbabies. Taking time to be with myself. I love that. And it could be pampering. I saw a patient yesterday who we were talking about. He's doing a running program, and I asked him if he takes his dog running, and he said, no. I was like, oh, well, maybe he can't because he's kind of a small dog. And he's like, no, that's my time. That's my time. The running is my time to think. It's my time. It's about me. And I was like, oh, you know what? It made me feel so much better because I walk my dogs, but when I'm running or I want some stuff for myself, I don't take them with me. And I feel bad about it sometimes, right? But it is about that self-care, self-kindness, self-compassion, being gentle with ourselves. Right? Even riding a bike, doing all this mindfully, engaging. Yeah, and noticing how you're talking to yourself. So we're starting to kind of teeter into some of the motivational interviewing and really thinking about, well, what is it? And MI spirit are the components that really are behind motivational interviewing. And one of them is compassion, where we're really thinking about ourselves and the people that we're helping. We're also working to empower them. So we believe that they have the skills and strengths, but we're helping them find and connect with it. And that's part of the partnership and collaboration. And then the acceptance, and a piece of that is acceptance of their autonomy to change or not change, depending on whether they want to, and also for ourselves. And so really just thinking about, there's lots that goes with motivational interviewing, the motivational interviewing spirit. This is, if you've trained in motivational interviewing, this is newer, the last edition, although we changed some, by the way, we changed some of the language in the very last edition. And these are the 4 tasks of motivational interviewing. So some of it is some engaging, really getting to know someone, get on the same page, and then focusing, what are we going to work on? And then you really dig out some of the change and then make some plans with them. It's not as linear or checkboxy as it looks, because we all know that a treatment process and treatment journey is a little bit of ping-ponging all over the place, and you're kind of always trying to figure out, I'm trying to drive you in a direction that you want to be driven and help consolidate that, but we might go all over and might wind up in different spaces while we're still trying to keep moving forward. And being mindful and present and aware is a huge piece of that. So I'm a big proponent, even when I train full motivational interviewing trainings, I'm often doing a little bit of mindfulness training with that, because it's so easy. We're humans helping humans, and it's so easy to not be as focused as we would like. These are the foundational skills of motivational interviewing. I think in fact, I'm going to go out on a limb and say all of you have these on board. It's really just about thinking about using them in a more consolidated fashion, open versus closed questions, really affirmations, or really connecting with someone's strengths and values and helping them see that you see that, but doing that for ourselves, right? Someone said that affirmations in the chat. I think there's a lot of stuff, right, of really just helping us connect with what we're good at and where we're strong. And we often forget, right? A lot of us have a very self-critical lens on, and the people that we're working with often have a self-critical lens because they're coming in needing help for things. And so helping orient them to their strengths, draw it out, help them see it for themselves. And then reflections are really listening. I was just talking about this in a consultation team this morning, and sometimes people are quiet and they look like they're listening, but are they actually listening and hearing? And so listening to be understood. So we do that for the people we work with, but we also can do that for ourselves to help consolidate and pull out some summaries. And again, this is the way you can take all this and apply it to yourself. This is important to me, right? I've invested a lot of time, energy in this. This is meaningful to me. Or I'm feeling stuck right now. And then thinking about, well, what small step can I take to move forward? Where can I start? Like, what might be helpful for me? Or, ooh, I'm noticing I'm feeling overwhelmed. It's okay to take a moment to breathe. And really just thinking about talking about to yourself that way, whether it's out loud or writing. In fact, I have patients record themselves because I think when they hear themselves talk, it is far more powerful than hearing someone like me talk to them. All right, let's do another fun exercise because this will get us to one of the other really important parts of motivational learning that I find really helpful. And this is from my book. So you'll have it here in your slides and to utilize. And I'm gonna ask you to get comfy. And just, you could pull out a piece of paper if you want, if you don't have already, or you could also just, I'm gonna ask you like to use a pen and paper in a second if you want to. But again, if you don't have that, just use whatever you have in front of you. If you're willing, close your eyes. If you're not willing, just train your eyes on something that's not moving in front of you. And I'm going to ask you to go back in your Rolodex of life experiences. Rolodex is kind of an old metaphor, huh? Go through as if you're flipping through the photos on your phone. And just really think about your life and when you're at your best self. When you're most energized, most engaged, you are living your best, most amazing life. Like, this is it. This is who I want to be. This feels amazing. Now, this could be yesterday, or it could be a time in the distant past. So allow yourself to flip through those memories for a second. I want you to really make contact with it. So really bring it to life. Think about who's around you. What are you doing? Where are you? What does it smell like? What does it look like? Really bring that best self to life as if you were going to show us the picture of it. And while you're doing this, I want you to just notice and be mindful of any stories you're also telling yourself, including the yes, but ones. Yeah, but I was young and vibrant. Yeah, but I don't know. I was a different person. Or yeah, I looked differently. Or yeah, but I don't have the time. Just notice them, right? But get the whole sense of who your best self is. And when you're ready, I'm going to ask you to open your eyes and jot down some notes, or even start sketching what your best self looks like. And if you're going bonkers because I'm asking you to draw, I included this in my book because I thought people should know that you don't have to be an artist to be effective in your behavior change journey. But here's an idea of what my best self looks like, and I want you to capture yours. So this is me high-fiving my husband. I'm trying to be mindful and present so I actually can be aware of how awesome it is to be at my best self. That's my daughter. She'll be 13 next month. And those are my schnauzers. There are 3 pictured. We lost one last year, and the other 2 are in the room right now. And if they wake up, I'll have them say hi. But they're sound asleep, I won't wake them up because that would be mean. But also surrounded by my community. Notice I have my laptop with me. So this isn't like some bonkers idealized size of my best self. This is literally, I love writing. I love speaking. My laptop is a huge vehicle. That is a huge piece of my best self. I wouldn't be here with you right now if I didn't have my laptop in front of us. And the sun is shining. I'm generally at my best self when it's 70 and sunny. We could have a whole discussion about why I moved back from San Diego, but that's a whole other talk that we could give. But this is my best self. And the collaboration, the energy, the engagement, the love, and the present moment awareness of actually seeing it and having and contributing, because that's members of my community on the left, these are all really important. So take a second and really capture what your best self is. And here's why this is important. It is one way for us to get at our values and what is important to ourselves. And it's very rare that we stop and we access our values and we remind ourselves of what's important to us. And values are a huge piece of motivational interviewing and a huge piece of how we connect with ourselves, but also how we help our clients or patients connect with themselves. So think about what values show up for you in your best self. And here's the thing, the best self might not be, maybe you didn't identify with that or you weren't super engaged with it. And by the way, I also want to honor the fact that we're moving a little more quickly just so I can give you these tastes and flavors of different things than I would do in a longer workshop or when I'm working with a patient. And so I'm essentially giving, I hope to like stimulate you with some stuff to come back to later, including the best self where you can really flesh it out, and the values, right? And so there's lots of opportunities to do values work. This is a values table that you could do. You could do a values card sort. Actually, I'll show you. This is why it's important to wear pants, because if you walk away, but I forgot about this until now. This is like one of my favorite things in the world. This is a Live Your Values deck. And I'll show you how beautiful it is. This is, look, activism is the first one. Look at how beautiful of a values card that is. And so if you can't see this, I can find the link and make sure we have it, but it's available on Amazon if it's ever, but you can also just have like the little printed ones or this little table. So I'm going to encourage you to think about values. Does anyone have any other ways that they assess values or have conversations with your clients about values? I love collaborating on value stuff. It's really important to me. Feel free to throw it in the chat. But you notice part of what we're doing, right? Even in the debrief or in the delivery is using our MI skills. Evoking with open-ended questions, affirming some of the strengths and values, reflecting back and connecting with folks. And then one of the next steps that I do, and I'm starting to do this with one of my newer patients is, and actually I just did this yesterday with a patient who we did values. Oh my gosh, it was probably about 6 months ago when I started working with him. He's doing really well. But I was like, let's revisit your values and let's look at how you're doing and where the alignment is and are there gaps? And so we think about really using kind of are there gaps? Are there pathways? How do we think about where are we going to go between who you are and who you want to be? So even me looking at my best self, which is in my book, thinking about, oh, well, am I really doing a good job of being present and aware when I'm with my husband and my daughter? So is that a gap for family that I should be thinking about, a behavioral target that I should put on my list and something I should be working on? Where is kind of that angst between who I am and who I want to be? And so this is where motivational interviewing shows up to help us think about a values assessment. And then are there gaps between our values and what is important and how we're actually living our life, right? And good news for my patient that we just did a values check on, he's killing it. He has figured it out. He has changed a lot of his behaviors, and including alcohol use, which is what he came to me for, and is really living his best life. He's just so happy. And we're getting ready to terminate because at this point, he doesn't really need me. So we're kind of in the step down process. And there aren't a lot of pathways for us. So I use this pathways worksheet both to set an agenda at sessions where I'll collaborate on an agenda, but also to set targets and treatment planning. And so really collaborating with someone and collaborating with yourself, like, what do you need to work on, right? When you're not feeling like your best self, something is off. And so what is it and what's possible and where do you start? And so really thinking about that. And one of the things we're always listening to or listening for here is change talk. So the currency in motivational interviewing is change talk. So different types of change. And the more change talk you get, we know from the science, the more likely you are to change. It's actually really simple. The more someone talks about change, the more likely they are to make the change. And so I'm always, as a motivational interviewing trainer, I'm always listening for change talk. And some of those yeah buts is kind of, well, some of that's what we call stuck talk, right? Of, well, ooh, if you're feeling a little too stuck. My patient yesterday, who's new and is working on his alcohol and substance use, is trying to figure out whether he wants to stay abstinent or wants to kind of drink normally or typically, right? It's a pretty typical thing that happens often in the beginning of treatment. And it happens with any change too, right? It's like, well, do I want to, it feels very black or white, but substance use is a little different. And so he's really thinking through. And I said to him, well, it sounds like you haven't quite figured out yet where you're at. You're feeling a little stuck. And that's a reflection. And he came back to me and said, no. I know I can't go back. I can never drink again. It's not, I've been here before where I've tried it to drink responsibly. It doesn't happen. I'm done. I need to drink. I was like, oh, that's a pretty strong statement. In my mind, I'm like, that is some pretty strong change talk. I didn't say that to him, but then I asked him more. I used my ORs, my open-ended questions. I reflected back to consolidate the motivation. And these are the type of change talks that you'll hear, both preparatory where someone's getting ready to do it, and then mobilizing where they're committed to do it. And we look at both the quantity and the strength of change talk. And he had some really strong change talk. And I'm really hopeful for him. I'm not always hopeful. I have some other patients I've written, and there's some stuff I've written about in my book where it's consolidated of these patients who sometimes I'm like, oh, you're not committed. And what keeps getting in the way? What are some of the voices, right? What's some of the stuck talk that's keeping you engaged? And so here's, we have an acronym for this: DARN, CAT, desire, ability, reasons, or need. And then CAT is the mobilizing, commitment, action, and taking steps. And so thinking about listening to what you're hearing. And if you're hearing a lot of change talk, you're reflecting it back, you're consolidating it, and you're getting ready to do a plan. If you're not hearing a lot of change talk, you're thinking of ways strategically to get it, to elicit it, to stimulate it. And I think activities like the best self, values cards, lots of different ways, perspective taking, it really helps. Now, one of the things you'll notice if you're savvy and trained in acceptance and commitment therapy is I do a lot of ACT integrated with motivational interviewing. I do a lot of CBT integrated with motivational interviewing. And again, it's all stuff that we could do for ourselves too. There's a worksheet that I have people fill out sometimes of really just, why would you want to make this change? So think about this for yourself. Let's just do a quick, we only have a few minutes left, but just quickly, why would you want to make this change? What have you done before? How have you changed before? Whether it's exactly like this, or is it something similar or different? What are your reasons to make this change? Why do you need to make this change? What makes it important to you? And then really thinking about how committed you are and what action steps are you doing? Would you believe my patient that I talked to yesterday, when we're wrapping up the session, and I asked him did he have any high risk? I often end sessions with, is there anything coming up that we should talk about? And he has a pretty big high risk situation, and he had already planned how he was going to manage it. And so those are some steps or action items that he's already taken. So think about, for you and yourself and your change, what's showing up for you. This is another tool or strategy we often use in motivational interviewing. So think about your change, and on a scale of 0 to 10, how important is it for me? You could ask yourself, for me to make this change. So 0 is not important at all. And 10 is very important, couldn't be more important. So think about where you land. And then ask yourself, what makes it that important? It's an open question. So ask, why is it so important to me? Even if it's a 5, why is it a 5? And then the follow-up question is, why is it a 5 and not a 0? So what puts it at a 5? Even if it's a 3, what puts it at 3 and not a 0? And then really just eliciting from yourself and evoking. And this is how we turn MI on ourselves. And we could teach our patients to do this, right? To have these conversations. The same with confidence and how ready you are. And what makes you that confident. And why are you at a 5 and not a 0? And then you could also ask, what would it take to raise a score? What help do I need? Right? Who's in my network? One of the other exercises in my book that is called the Change Master of the Past, where you really have someone think about a time they changed in the past that was successful and what worked well and what were the components so that they can help flesh it out, right? And really just thinking about, and so think about the change you're working on and think about a time that you made it successfully. And what was that secret sauce? What went into it? Now, here's the thing, and this is where we're going to wrap up. We're getting there. People often say motivation doesn't last. Well, neither does bathing or showering. And that's why we recommend it daily. We've got to stay in it and working on it to really make it happen. So before we totally take a second and just, what are you taking away? And then I think we have a couple minutes. Oh, you can scan this and I can send you some more resources if you want, or you could just reach out to me and I'll send you, there's a clinician's guide that I can send. But all right, any questions or thoughts? I know we have like literally 2 or 3 minutes, right, Joni?
Yeah, we have about 3 minutes. So if you have any questions, please use the chat or the Q&A feature. As we're waiting for questions, I'm just going to put a few bits of information in the chat. Some information about accessing the recording, accessing additional resources.
Oh, Joni, you muted yourself.
Oh, sorry about that. I'm good. And then also the survey for this, our workshop. So please, if you have a question.
If you have anything else that you use, any tips, tricks, tools that you want to share, I'm sure we'd all love to hear too. Like it sounds like someone uses the questionnaire for values, uses the values card. If there's
Someone
anything else that
the VIA character, someone mentioned that in the chat. We learned about that in one of our earlier workshops.
Oh, what is that? I don't think
it's a character questionnaire to kind of draw out some of your
yes, I do know about that. Okay. Yeah, that's awesome. There's a strength. It's like a strength thing.
Yes,
right?
yeah.
Yes.
Your strengths and characteristics.
Very cool.
And again, the information in the chat identifies that you can access our materials through the website. And also, if you have additional follow-up questions, please reach out to our email listed here, northeastcaribbean@mhttcnetwork.org. Thank you so much, Dr. Drapkin. This was wonderful. I learned you had so many great interactive and engaging activities that I'll be sure to use in my personal life moving forward. So thank you again, and thank you, everyone.
Thank you so much, and thanks for having me. It's been lovely spending speedy, but lovely. So thank you.
Safe travels.
Thanks.
So we will be taking a break 12:15 to 1:05, or a little bit before 1:05. The next sessions are from 1:05 to 1:55. One session is the Recovery Innovations Roundtable, and then we have a workshop at that time as well on school-based funding. So please return back to your conference auditorium and choose what session you'd like to join at 1:05. Thank you, everyone. Bye-bye.